Hi YouTube, it's Zen Maiden 1. How are you? Melody, and I'm coming in today to give another update on my pre-op DS upcoming surgery. So stay tuned, and here we go. For those of you who don't know me, again, I'm Melody, and I had the VSG surgery November 15th, 2011. So it's almost 10 years out. So I've had some regain and some additional health problems pop up. So I'm looking to do a serious revision onto the DS, the Duodenal Switch surgery. First thing you guys have to consider is who will your surgeon be? So depending where you live, you're going to need to research out the best ones for your area and find out, that your insurance covers it or not, and then make decisions accordingly. So I've been doing some research, and I chose Dr. Ara Keshishian, and he's in Pasadena, California. So he's local to me, and he has lots and lots of experience. So you guys, when researching a surgeon, and I am not going to steer you one way or the other on that issue, you will need to do your own research, find out what surgeons are in your area, and interview them and find out who will be the best fit for you and who will deliver you the best DS and follow-up for the years to come, because DS does require a lot of follow-up. So a lot of vitamin checking and a lot of levels, and to make sure that your bones and your eyes and everything stays healthy. So anyway, choose a surgeon wisely. Okay, that's tip number 1. So the hoops, insurance makes you jump through hoops, and if you're paying cash, you're lucky. But mine makes me jump through several hoops, and I started the process in April, speaking with my primary care doctor. That time I needed referrals, so he gave them to me to go to all the different specialists. So in June, I changed over to Medicare because I am now 65. And they have a couple of hoops too. So starting with meeting with your primary care doctor, I had to get 4 months of notes from my primary doctor that I am interested in weight loss surgery, that I'm doing what I can to diet and exercise, and he will send the notes in, and that will be sufficient. I don't have to go on any wild, crazy diet or take pills or anything like that, or Optifast or any of those things for him to certify that I've been working on weight loss for the last 4 months. So then I had the initial consult with Dr. Keshishian, sorry, I keep saying it wrong. And so I had an endoscopy done in June. That's where you go under sedation, and they put the tube camera down your throat, and they go in and check out your stomach and your intestines and so forth. I also had a colonoscopy at that time because it was that time. Anyway, I was out. It doesn't matter. The next thing I had to get done was a cardiac clearance. So I went to the cardiologist twice, once for the visit where he checked me out, did EKG, and then the second time they did ultrasound of the heart, which is necessary for some people. Luckily, everything's good, so I got a clearance on that. I had general blood work done. Then the Dr. Keshishian ordered special blood work for vitamin checking. So I had that done recently, and that should be at their office. I had a psychology visit. Oh my gosh, we could probably make a whole video on the psychology visit, but it really wasn't that dramatic. You fill out a questionnaire, it's pretty basic. And then they ask you questions about the surgery, about your knowledge about it, about your purpose for having it, etc. So it's really pretty basic. And if you were crazy, you could probably hide it and answer the questions correctly and still get the surgery. So all y'all out there who are wondering if you can pass, you can pass, just saying. So the other thing I had was an upper GI. This was ordered again from Dr. Keshishian. They want to be able to see, what does your sleeve look like now? It might have been perfect 9 years ago, but it might not be perfect today. So they want to check that out and look at it, and they check out how you swallow, how the food goes down, etc. Because I have reflux, so they're going to find that on the swallow too. So yeah, that's basically it. Oh, the nutritionist visit. I had one visit with a hospital nutritionist, and it was very brief, like a half an hour. She referred me to the handbook that Dr. Keshishian's office uses for their DS patients. It's available on their website if you are a patient of theirs, so you can download it and refer to it. There's all kind of information about pre-op, post-op, foods, healing, all kinds of information that will be very valuable to you if you're a DS patient. And if you're using a different surgeon, I'm sure they have one too, their own. So I'm very excited, preparing. I think I've jumped through all the hoops. Now I just have to make sure they got the doctor's notes over there and the CD of my upper endoscopy. They should be receiving today because I mailed it just to make sure they got it in a timely manner. So I'm down about 6 pounds. No, from last time I'm down 2 pounds. So I'm 219 right now. And so hopefully I'll be able to get down another 9 pounds or so before surgery, just to make it easier on my liver, to shrink my liver up. So I will probably be doing a 1 or 2 week, real liver prep diet. It will be a lot of liquids and maybe a little bit solids, and up until the end when I have to do the full liquid, clean out and everything right before surgery. So I'll be keeping you guys posted and letting you know when my date comes up. Oh my gosh. Or I'll just come on here and ramble. But anyway, for you guys who are looking for DSers to follow, it's a great honor if you follow me. I hope you can click the subscribe button and the little bell notification that will notify you every time I upload a new video. I'm an old timer, guys, in many more ways than one, but I do have lots of information, lots of experience with the gastric sleeve, and I hopefully want to become a valuable resource to you guys for YouTube, for people going forward, paying it forward to people coming along behind me who might be older, who want to see what's going to happen when that person gets a DS surgery. So thanks to everybody again for following me and watching my video, and I really appreciate it. Any comments you have or questions, please leave them down below. Please remember to be kind, because I don't respond well to unkindness. I mean, I'm sure most people don't, and I try to always be kind in my responses to people. Anyway, have a great day, and I look forward to seeing you again next time. Bye.